Dr. Park, let's talk about teeth grinding in children, because that's who and what you treat, children. Where does it come from?
Yes.
Why is it there? What does it do? Can it be avoided?
Well, teeth grinding is very common in children, and many parents ask us about that. They're concerned if it's harmful to the teeth and what can be done about it. No one knows exactly what the cause is. Sometimes we think it's related to stress, but you wonder what stress a 6-year-old child may have. We don't necessarily have to worry about it in children. It is very rare that it creates a problem. They tend to outgrow it, luckily. Maybe it comes back later as an adult, but as an adult, that's relatively easy to deal with a night guard. Many parents have asked about a night guard for their children, and we've attempted that a few times and discovered that the children have a hard time keeping the night guard in all night, so it tends to lose its effectiveness.
So basically, since the worry about the teeth grinding, even if those are already the second set of teeth, the ones which stay there forever, it isn't necessarily all that big of a problem?
Yes. Once you get to the permateeth stage, and if someone's grinding and we can see wear on the teeth, then we're a little concerned. But just because someone grinds their teeth doesn't necessarily mean they're wearing them. They may not be doing it strongly enough to cause damage. They just may be making noises with it.
I see. And so basically the night guard is pretty much one of the better solutions for it, if something should be done?
That's really about our only course of treatment. There are some attempts that you actually adjust someone's bite by selectively grinding down areas of teeth, but then you have the possibility of creating some sensitive teeth by removing tooth structure. So overall, the most convenient and simplest method of dealing with tooth grinding is a night guard.
Okay. And does a night guard make the grinding after a while kind of go away, meaning the mouth adjusts to it, or is that then on an average something people wear forever?
You have both situations. Sometimes wearing the night guard for, say, a month, and they can stop wearing it for several months, and they do not grind their teeth, and then all of a sudden they start grinding their teeth again. For other people, if they don't wear it, they just grind their teeth constantly. So for those type of people, yes, it's a lifelong process where they should wear their night guard all the time when they're sleeping.
And what problems, if they keep grinding, will be actually happening? What are they, so it makes noise, as you said. You mentioned that one. Is there any other effects which become eventually, if it happens for too long?
The grinding can cause wear on your teeth. And if you have fillings or crowns, you can actually start wearing those down to the point where they'd have to be replaced. Aesthetically, as the teeth get shorter and shorter, it tends to actually give us an aged look, which maybe is typically undesirable. Some people, it may contribute to eventual TMJ problems, but that's hard to predict. It's impossible to predict how much effect tooth grinding would have on that.
Okay. By TMJ problem, you mean the joints here kind of becoming out wacko, loose, or somehow not quite aligned?
Yes, our TMJ joints, our jaw joints could wear, and just like someone's knee joint or elbow from tennis elbow, you would have joint problems, pain, swelling, irritation, pain just on moving your mouth, whether to speak or to open to eat. Those are complications that could develop.
Okay. Well, like always, thanks for talking to us and very informative. I hope it will help the listeners, and I'm sure it will. Bye-bye.
Thank you.